For centuries, humanity has basically been locked in this high-stakes war with a microscopic assassin. I mean, it's a disease that has literally shaped our history, altered our genomes, and completely defined global health infrastructure. Welcome to this explainer on malaria. Today, rather than just throwing a bunch of statistics at you, we are going to break down the exact step-by-step strategies this parasite uses to infiltrate the human body. And, much more importantly, we're going to look at exactly how modern medicine fights back. To really unpack this invader's playbook, here is our game plan. We'll start with a global threat, meet the microscopic invaders themselves, see how they hijack the human body, review our clinical defenses, and finally, look at prevention and the future. All right, let's dive right into part one, the global malaria threat. To put things in perspective, malaria heavily zeroes in on the most vulnerable among us, particularly young children and pregnant women across endemic areas like sub-Saharan Africa, South Asia, and South America. But hey, humanity has a pretty long, resilient history of fighting back. I mean, for the longest time, we didn't even know what was actually making us sick. It was only when we finally discovered the Plasmodium parasite and linked it directly to the bite of the Anopheles mosquito that the tide really began to turn. We went from relying on early botanical treatments, like quinine, all the way to discovering artemisinin, which is an absolute game changer and forms the backbone of the incredibly effective modern therapies we use today. Moving right along to part two, let's actually meet these microscopic invaders. So here's the thing, this disease isn't caused by just one uniform enemy. It's actually a whole family of specialized microscopic assassins. Plasmodium falciparum, that is the absolute heavy hitter. It's the most prevalent in Africa, and it's the one responsible for the vast majority of severe, life-threatening cases. On the flip side, you have Plasmodium vivax. Now, it might not be quite as immediately fatal, but it possesses this terrifying evolutionary trick. It forms what are called hypnozoids. These are basically dormant liver stages that can hide out completely undetected and then suddenly wake up to cause disease relapses months or even years after that initial mosquito bite. Crazy, right? But of course, these microscopic invaders need a ride. They need a delivery vehicle. And that journey starts in standing water, as a tiny egg, morphs into a larva, then a pupa, and finally emerges as a rapid-winged threat, the Anopheles mosquito. And here is a super vital piece of trivia for you. Only the female Anopheles mosquito actually transmits malaria. Why? Because she specifically needs a blood meal to develop her eggs. So when she bites an infected human, she ingests the parasite, becomes a carrier, and the whole vicious cycle just keeps going. Okay, part three, inside the human body. Let's look at the parasite's life cycle. What exactly is happening under the skin when that infected mosquito finally bites a human host? Well, picture this. The mosquito silently injects the parasites in a sneaky form called sporozoites. These guys rapidly travel straight to the host's liver, where they quietly multiply, flying completely under the radar of our immune system. Then, once they're ready, they burst out as thousands of merozoites, just flooding the bloodstream. They aggressively invade our red blood cells, multiply inside them, and literally tear the cells apart to go infect even more. Finally, some of them develop into gametocytes, just waiting patiently in the blood to be sucked up by the next biting mosquito. It is a complete cellular hijacking. And that sudden, massive cellular explosion in the bloodstream, that is exactly what triggers those exhausting classic symptoms of malaria. Because the parasites actually tend to burst out of the red blood cells all at once in these synchronized waves, patients experience cyclical, intense fevers, followed by incredibly heavy sweating and just debilitating chills. And as more and more of those red blood cells are destroyed, the body is basically starved of oxygen, which leads to severe fatigue, muscle pain, and profound anemia. Now, if this infection is missed or untreated, things can escalate incredibly fast into severe malaria. We're talking about a terrifying medical emergency here, where the parasite actively compromises the brain and major organs. When those infected red blood cells become sticky, they can actually clog up the tiny blood vessels in the brain. This causes cerebral malaria, leading to confusion, seizures, and even coma. Kidneys can start to fail, lungs can fill with fluid, and a patient can rapidly slide right into multi-organ failure. That is exactly why early detection is absolutely critical. So, how do we fight back? Part 4, Diagnosis and Clinical Defense. Stepping into the hospital setting, doctors literally have to play detective here because malaria is a master of disguise. It can mimic all sorts of other tropical diseases. Clinicians really have to parse out the subtle differences. For instance, comparing the cyclical nature of malaria fevers against the severe crashing bone pain you'd see with something like dengue fever. Spotting those clinical clues is what prompts them to order the right laboratory tests to confirm exactly which invader they're up against. To actually confirm the enemy is there, the gold standard is still the thick blood smear under a microscope. This allows lab techs to scan a large volume of blood and just ask one simple question: is the parasite there? Once they get a yes, they use a thin smear to identify the exact species. But let's be real, in remote or resource-limited clinics where you just don't have access to good microscopes, rapid diagnostic tests, or RDTs, have been an absolute game changer. They work incredibly fast, kind of like a pregnancy test, but for malaria, allowing for instant, life-saving triage right out in the field. Once the invader is identified, clinicians launch a highly tailored counterattack. They don't just use one drug for everything, they tailor the antimalarials based on the specific parasite species and how sick the patient is. For most straightforward cases, the frontline weapon of choice is ACT, artemisinin-based combination therapy. This pairs a really fast-acting drug with a longer-lasting one to help prevent the parasite from developing resistance. Now, if a patient is in the ICU with severe malaria, doctors immediately escalate to IV artesunate to drop that parasite count as fast as humanly possible. And if the culprit turns out to be that tricky Plasmodium vivax we talked about earlier, they have to use primaquine to flush those dormant parasites out of the liver. But, and this is a big but, they can only do that after running a G6PD enzyme test to make sure the drug is actually safe for that specific patient. When you look at real-world clinical scenarios, you really start to grasp just how much early, accurate diagnosis changes everything. Imagine a young child in an endemic area. If they're given antis at the very first sign of a fever, they can bounce back so quickly. But compare that to an unprotected traveler returning home, right? They might just dismiss their early symptoms as a simple flu. By the time they realize something is wrong, P. falciparum could rapidly escalate into an ICU admission requiring IV artesunate. And we also have to consider pregnant women, who require highly specialized care because the parasite can severely impact both maternal and fetal health, leading to low birth weight and severe anemia. The stakes are just incredibly high across the board. Which brings us to our final section, Part 5, Prevention and the Future. How do we stop the spread? Because honestly, treating the disease is absolutely critical, but stopping that mosquito bite from ever happening in the first place, that is how we actually win this war. These straightforward vector control strategies are our frontline armor in endemic regions. Since we know the Anopheles mosquito primarily bites between dusk and dawn, just sleeping under an insecticide-treated bed net drastically cuts down transmission rates. Combine that with spraying the inside walls of homes to kill resting mosquitoes and giving preventative medicines or chemoprophylaxis to travelers, and we're effectively disrupting the invader's delivery system at multiple different choke points. And this brings us to our absolute newest frontier in prevention: breakthrough vaccines that are finally offering immunological shields to the most vulnerable children. After decades, literally decades of research, the RTS S vaccine became the first one ever to get approval. It was a hugely historic moment in public health. And now, the newer R21 vaccine has joined the global arsenal, showing really highly effective results. These vaccines are amazing because they actually train a child's immune system to attack the parasite the exact moment it enters the bloodstream, completely stopping it before it ever gets a chance to reach the liver. The beauty of all this is that we aren't just guessing out there. These clinical and preventative tactics are all unified under incredibly strict evidence-based guidelines from major organizations like the WHO. We need a standardized global counteroffensive. By universally applying these specific protocols, meaning we test every suspected fever, we treat rapidly with effective combination therapies, we scale up bed net usage, and we roll out these incredible new vaccines, we are actively shrinking the parasite's territory year by year. As we wrap up this explainer, I really want to hammer home this one powerful takeaway from our source material. This is not a disease we just have to accept as a fact of life. Through clear scientific understanding, rapid diagnostics, potent meditations, and rigorous mosquito control, malaria is absolutely something we can intercept, fight, and defeat. It is entirely preventable and treatable. So, knowing everything we now know about this invader's playbook, the science is literally here, and the tools are in our hands. The final battle isn't really a scientific one anymore. It relies on global will, continued funding, and immense community awareness to deploy these solutions to every single corner of the globe. So I'll leave you with this question to think about. Since we have the knowledge to both cure and prevent it, what is it actually going to take for global society to eliminate this ancient invader once and for all? Until next time, stay curious and keep learning.